Climate change is a multifaceted crisis, and of course over the last few years we've been rapidly learning the true scale of the challenge that it brings. Well, one aspect that is either overlooked or little spoken about is maternal and reproductive services for women. So as the impacts of drought and the urgent need to travel in search of food, water and pasture takes priority, the BBC has seen shocking evidence showing that the number of women being able to access family planning services has dropped by more than 50% in some areas in Kenya. That is a lot of choice that is being removed from women's lives. Well, the BBC's Mercy Juma has travelled to Samburu in the northeast of the country to join a rather unique nursing team that are taking this key service, which can mean life or death for these women, on the road and following them and hopefully giving them that choice back.
Cramped up in the back of a donated ambulance, a team of healthcare workers drives out into rural Samburu, northeastern Kenya. Through endless miles of barren earth, across dry rivers and with extreme temperatures, they are looking for women and girls who have abandoned their homes in search of food and water and who are now going further and further away from health facilities.
We get young mothers having more than 2 kids, more than 3 kids, and the same mothers are expecting, and still they do not have the information on family planning. The community would rather put food on the table than to go look for family planning.
With little resources and no shelter, under trees and by the roads, the nurses provide antenatal care, vaccinations and family planning services. Ampoile Lena is a mother of 6, and in the past 5 months she has lost 2 pregnancies. She heard where the mobile nurses will pass through and had to make a 2-day journey to get to them.
It has been so many months with no rain. I have been moving from place to place to look for pasture for my goats and food for my children. There is no health facility where I stay, and it's been hard to get family planning, which is what I need the most now so that I can focus on taking care of the children.
Today, she gets a 5-year implant inserted under her arm. Life is unpredictable, and climate change has made it worse. So many of these women choose long-term family planning methods when they can. Family planning records seen by the BBC from several health facilities in this region are showing fewer and fewer entries with each passing month. If you look at the family planning register for this facility, you realize that the few who got services here within the last 2 or 3 months are new clients. And the administration says it's because they are people who are migrating to other areas in search of food, water and pasture. Officials say this is the situation in most parts of this region, where severe drought has forced thousands of people to migrate.
That is why we get the unplanned pregnancies. That is why also we get so many people falling sick and they cannot access the health facilities because some of them move as far as 120 kilometers away, 150 kilometers away to the mountains. So that makes our contraception uptake to remain still very low.
Often, the search for contraception takes a backseat to other pressing needs. In areas like this, it usually falls to women and girls to fetch water. But with the severe drought, they are traveling far and having to dig into riverbeds for long hours. Many are exposed to sexual exploitation, violence, and abuse on their search. A multi-pronged crisis underpinned by a rapidly changing climate. Mercy Juma, BBC News, Samburu, northeastern Kenya.